I'm Daneen Akers, and I'm the author of this book, Holy Troublemakers and Unconventional Saints. It's full of people of different faiths whose life and work and witness I really admire, and they were inspiring to me, and I wanted to write them for my own children and for other children who needed to see faith heroes who were really working for the common good and for more love and justice in this world. And at this exact moment, many of us are at home a lot of the time right now, and I thought a digital story time might be a wonderful way that we could connect a little bit and help pass some of the time. So we're going to try this every Friday night as long as this COVID-19 coronavirus time lasts. I thought I would start with the profile of somebody who has a lot to do with why we have public health today, Florence Nightingale. And I love the artwork for Florence. This portrait of Florence was done by an artist named Daneen Akers, and she did this as a lino cut. Lino cuts are often done in wood. They can be done in other mediums as well, but it's one of those art forms that is a subtractive art form. So in other words, you are taking away from the lino cut the pieces that you don't want to have there, and then you're going to put the lino cut down onto some sort of material and ink it, and that's how your picture is. So you almost have to work opposite of how a normal portrait works. So I thought she did a wonderful job of capturing Florence Nightingale. I'm gonna guess many of you have heard of Florence Nightingale. She's pretty famous, but a lot of people only know about Florence Nightingale from her time as a nurse and how much she changed modern nursing, which we are very grateful for today. But there's more, and I wanted people to know a little bit more about her faith and some of the ways in which she used that faith to help other people. All right, if you have a book at home, you can read along. It starts on page 56. And parents, this kind of counts as great reading time if they're reading along, right? A small lamp casts light at the end of a long hospital hallway late at night. A woman in a long dress with an apron makes her way carefully down the hall, peeking her head into rooms full of injured soldiers. She checks in to make sure each patient is as comfortable as possible. "Thank you, nurse," one man says as she helps him reach a glass of water. "You're welcome," she says quietly. "Now, get some rest. Your body needs sleep as much as any medicine." It's 1854, and this is a field hospital in what is now Istanbul, Turkey, during the Crimean War. And the Crimean War is a glossary term at the back of the book. I'm not going to read through all of them, but I just want to make sure that you do know where they are in case you're reading this book at home. And the Crimean War, there we go. It was a conflict between 1853 and 1856. So that time period in the United States was close, just before the Civil War here, if that helps you put the timeline in perspective. And it was a conflict between Britain, France, Turkey, and Sardinia against Russia. So the Crimean War, and this was a military hospital in Turkey where Florence was working. And the woman doing late night rounds here is Florence Nightingale, known now the world over as the Lady with the Lamp and the founder of modern nursing. Florence's pioneering work improving sanitary conditions in hospitals and implementing basic guidelines like frequent hand washing, that probably sounds familiar to all of you right now, and daily laundering of linens and bandages saved the lives of thousands of British soldiers during the Crimean War. But many people don't know that in addition to being a nursing pioneer, Florence was also a scientist, a statistician, and a woman of deep faith. Florence was born in 1820 in Florence, Italy, to a wealthy British family. Her parents returned to England when she was young, and Florence grew up on large estates. Her parents expected that when she was grown up, Florence would marry a man from a similar social class, keep a fancy house, and have children. But Florence had different ideas. From a young age, she found social gatherings awkward and preferred being away from the center of attention. She found ways to help people sick in the community, especially those from poor families. Luckily, Florence's father believed in educating his daughters beyond the rules of social etiquette and running a household. He taught her Italian, Latin, Greek, philosophy, history, mathematics, and writing. Florence loved learning, and she especially loved mathematics. When she was 17, Florence felt a direct call from God to serve people through nursing. She had to muster every ounce of determination she could to convince her parents of this. At the time, women from wealthy families were expected not to have a profession or to be employed. Additionally, nursing wasn't seen as a respectable profession for women. After she turned down a marriage proposal from a young man her parents really approved of, Florence finally convinced them that marriage and family life were not for her. She knew God wanted something else from her. She wrote in her diary, "God called me in the morning and asked me what good I would do." Her parents relented and sent her to a Lutheran nursing school in Germany. When Florence returned to England, she took a job at a London hospital. Within a year, she was promoted to superintendent. In 1853, the Crimean War began. Photographs and reports from the front lines showed the British public that injured soldiers had to endure appalling conditions in the field hospital, and Florence was recruited to help lead a division of nurses to help. Within days, she and several dozen nurses, many of them who were Catholic nuns, sailed to the British base in Constantinople. She became the first woman in charge of a field hospital. The conditions at the hospital were even worse than the reports had said. Built over a cesspool, that's essentially a sewer, the hospital had dirty water, rats in the hallways, and putrid air. The men had little food, soap, or clean bandages. They were dying of infectious diseases such as cholera and typhoid at a much higher rate than they were dying from their battle wounds. The nurses went to work cleaning, organizing, and caring for the injured soldiers. Florence believed that healthy living conditions such as fresh air, good food, clean linens, and access to books and the outdoors would help the men improve as much as anything else. She also implemented frequent hand washing, even though germ theory was not yet widely understood. At that time, sometimes doctors and nurses would go from patient to patient to patient without washing their hands in between, if you can imagine. That definitely doesn't happen anymore, and we have Florence Nightingale for helping us understand why that's a good thing. Soon, the death rate at the hospital improved dramatically. When before more than 40% of the injured men died, the rate after Florence took charge dropped to only 2%. That's a huge increase in men getting better and going home. Florence returned home to public praise, an award from Queen Victoria, and a grant for a large sum of money from the British government. She used the money and the goodwill to start the Nightingale Training School for Nurses, the first secular nursing school in the country. Florence had many ideas about how to reform hospitals in the military and for civilians based on her experiences. She wrote detailed reports arguing for changes based on the data she had observed firsthand. She was gifted with statistics and graphical presentations of information, which was a new concept at the time. Her use of polar area diagrams, charts and graphs that show complicated information visually, was revolutionary for her time. This graphic that the same artist, Daneen Akers, did is not exactly, it's an artistic representation of a type of statistical graphic that Florence invented. If some of you have ever seen a pie chart, you know that it's often divided into pieces on the pie. Well, sometimes there's one of those slices or two that are broken into further bits of information, and that is what Florence invented, and her ability to show the data was really convincing. Due to her fame, skill as a writer and statistician, her family wealth and connections, and the popularity she had in the press because of her impressive reforms at the military hospital, Florence won the respect of military leaders and politicians. Her ideas led to sweeping hospital reforms in both military and civilian hospitals. Modern nursing was born. Florence wrote a textbook on nursing that became the standard all over the world. In addition to modern nursing reforms, Florence also helped the average person live many more years simply through better hygiene and public sanitation. She helped influence England's Public Health Acts of 1874 and 1875, which required property owners to connect sewage pipes to main drains. These public health and sanitation changes led to the average British citizen living an additional 20 years. Isn't that phenomenal? Just better hygiene really, really helped improve the health for a lot of people. And today, many of us are staying home because our public health departments have decided that this is the very best way for us to stop the spread of the COVID-19 virus. And we have Florence to thank for helping us understand that these health measures need to be taken very seriously, and that actually laws and things like that can help the entire population stay healthier. She would be really proud of all of you who are at home right now and doing your part. While Florence is remembered for her heroics in the Crimean War, most people don't know that she also lived with chronic pain and fatigue. Much of her writing was done from bed because she developed an illness during her time at the field hospital that left her with frequent fevers, night sweats, intense muscle and joint pain, and depression. While we can't know for certain what health condition Florence had, her birthday is now celebrated as the National Fibromyalgia Awareness Day because her pain, fatigue, and subsequent depression are symptoms that so closely match the symptoms of fibromyalgia patients. Throughout her life, faith mattered greatly to Florence, but her expression of faith was very unconventional for the time, much like her life's work. She remained a deeply religious person and a member of the Church of England, but she was accused of unconventional beliefs. She kept many private diaries and wrote extensively to friends about her religious questions and convictions. She had little patience for the male-dominated authority of the church, and she never tired of learning about the world and other cultures. She believed strongly that all religions contained truths and deserved respect. Florence questioned the concept of hell. She thought that a truly good and loving God would likely find a way to save all people. She once comforted a dying prostitute who thought she was going to be condemned by God with these words, "My girl, are you not now more merciful than the God you think you are going to? Yet the real God is far more merciful than any human creature ever was or can ever imagine." Florence lived her life dedicated to serving other people. She had little patience for religious people who worried endlessly about their own private salvation. Instead, seeing the suffering of people around her made Florence convinced that our job is to work on behalf of others. She wrote to a friend about this underlying motivation for her life's work. "There will be no heaven for me, nor for anyone else, unless we make it." And I put a couple prompts at the end of these, which maybe are a good conversation starter for you, or maybe other questions come up. But one of the questions that came to mind for me in writing about Florence and learning more about her life is, how might being unconventional in life lead to breakthroughs and new ideas? Florence was absolutely thought of as very unconventional, and that wasn't always a positive thing in the time that she lived, especially for a woman from her background, where there was very, very strict expectations and ideas about how she was supposed to behave. And her family was not happy at all about her choosing to be a nurse. That was pretty scandalous at the time. And yet, because of what she did, we now have a far better health system to help us out at times like this. One of the things that I was trying to think about is, what do you think Florence Nightingale might want us to do right now? What are some things that we can step into in the spirit of Florence Nightingale? Obviously, I think the hand washing. I don't know if any of you have favorite songs you're singing while you wash your hands. I have a 4-year-old and an 11-year-old, and the 4-year-old in particular is really learning her ABCs right now because she's singing the ABC song as she washes her hands, sometimes twice through. And we are washing our hands whenever we come in from outside, even though we're not interacting with anybody outside right now. We still wash our hands all the time, and that would make Florence incredibly happy to know that we're doing that. So one of the things that I think we could do in the spirit of Florence Nightingale is know the right names for the illness that people are worried about right now. She would definitely approve of good, solid scientific information. And it's really important to make sure that we use the right names for things. Sometimes people use names that end up really hurting whole groups of people. Out of bit of curiosity, there's a famous flu that happened in 1918 that was another worldwide pandemic. And it was called the Spanish flu, but it didn't actually start in Spain. It started in the United States, in Kansas. But it was the Spanish press that reported most widely about it, and it got the nickname the Spanish flu. But it didn't actually start in Spain. So we used to name things like new diseases where we thought they came from, but we were often wrong. And it sometimes became an excuse for people to be mean to groups of people. And so we have stopped doing that. There's an organization called the World Health Organization that names new viruses when they come up, because this does happen from time to time. There are actually quite a few coronaviruses that humans can get. One of them is just the common cold that I'm sure you've had many times. Most of us get them a couple times a year, and kids get them even more because the immune system of children aren't entirely familiar with all of them yet. So this particular coronavirus is actually technically called SARS-CoV-2, but that's a complicated thing. So people are generally say coronavirus, or the actual disease that it's called is called COVID-19. And that is an acronym. So the CO stands for corona. The actual virus, when you look at it under microscope, and I have a picture I can show you. This is the virus up close, and it looks a little bit like it's wearing some crowns. And in Latin, crown is corona. So that's why these are called coronaviruses. They look like they're wearing crowns up close. So that's what the CO for is in COVID. The VI is for virus. The D is for disease. And 19 is the year that this virus emerged, at least in humans. So it started at the end of 2019. And so COVID-19 is the right name for the disease that is going around. And it is not very scary, especially for children. Children are not being hurt by this very much at all. We're just all being careful so that those who might be more vulnerable, our grandmas and grandpas and aunties and uncles, we want to make sure that they are as safe as possible, and that if we spread out how long people get this virus, the healthcare system, our hospitals, won't have to treat everybody all at once who do get affected more by this. So that's why we're all staying at home and keeping our social distance. And I think Florence Nightingale would be really, really proud of you for that. So one of the things I was wondering is, how can we brainstorm ways to love our neighbor when we need to stay at home to be loving right now? I have seen some really wonderful ideas. I've seen some people writing chalk messages in the road in front of their house, reminding the neighbors, "Hi, we love you." I have seen some people in an apartment building putting different little notes and drawings in their window every morning as a way to say hi to neighbors. In our family, we have a friend who is living in New York City, and he is sick with COVID-19. He's not seriously ill, he's recovering, and yet he's all alone and having to be quarantined for quite some time. And so we're gonna be dropping him a little thinking of you card tomorrow with a picture. We have a nurse on our street who works in the emergency room, and we're going to carefully, using hand wipes, drop a thank you letter in her mailbox to say thanks for all that she's doing, and make sure she has our contact information in case she needs anything. We had some extra N95 masks, which are the serious masks that healthcare workers need, left over from our time when we used to live in California and there was wildfire season where often the air was smoky, but we don't need those masks anymore. We live in North Carolina now. And so we gave those to a friend who was a nurse whose office did not have very many. There's some things that I think we can brainstorm to try to be loving to our neighbors, even though we can't hug and see them in person right now. I'd love any ideas that you have in your family of how you're loving on family and neighbors. Maybe you're spending extra time calling grandparents who can't come over right now or something like that. Please feel free to send me your ideas. I think it would be great to share those. It is actually really easy to email me. I wanted to show you the holytroublemakers.com website. So that's just holytroublemakers.com. And if you look, there's a really easy contact. And you just click contact, and you can send an email either through the form or to support@watchfire.org, and that comes right to me. And I would love to hear from you. If you have a request for a profile you want me to read next time, let me know. If you have a question about any of the artwork in this book, whether it be about Florence's artwork or any of the other artwork, I'd love to hear from you. And let me know what stories you'd like to read while we're doing some holy troublemaking at home right now. I had one thing that I wanted to finish on. My older daughter, her name is Lily, and she is 11. She turned 11 just before Christmas, and she wrote a prayer a couple weeks ago, and it was a prayer that she wrote first for her little sister, and then I loved it so much that I memorized it and have been saying it for myself every night too, and I shared it on social media, and a lot of people really loved it. I think I'm going to try to help her make this into a card or a magnet or something that people can have at home. But I thought I'd share it with you. It's a lovely little prayer if you would like to say it anytime, but especially at bedtime. God of love, God of peace, help so I shall sleep with ease. Let my dreams be sweet and true, and know that I am loved by you. And I think that's a really nice thing to be ending our days on right now when sometimes there's more anxiety. Let's remember that we have a God of love and a God who loves this whole world and every single person in it. It's been really lovely trying this with you. This is our first time, so thanks for your patience, and I'd love to hear from you. You can just go on to holytroublemakers.com and click that contact and send me an email. And if you have any questions or requests, I'll start the next one answering those before we read a story. Thanks so much. Good night.